Hi, my name is Brittany Gonzalez. There's an elderly patient at the nursing home who receives eye drops, and she has been getting diarrhea, but no one really knows why. Turns out that the eye drops that she has cause systemic effects, which means can go into the body if not given properly. I am here to teach you how to administer eye drops properly. I'm a nursing student, so I passed up on the skill on how to administer eye drops, so I know how to give them properly. So before we begin, we need a few supplies. So a washcloth, some tissue or cotton balls, your medication, and some gloves. Before we begin, I need to prepare my supplies. So I need to wash my hands, I need to look at the medication and compare it to the MAR. So I have Visine, and it's used for redness, and it's not expired. So I'm going to go into my patient's room and I'm going to explain the procedure before I begin. Hi, my name is Brittany. I'll be your student nurse today. Could you please state your name and date of birth?
My name's Kyle Hook, and I was born on 12/15/1989.
Well, you are scheduled to have your eye drops given, so I'm just going to wash my hands and then we can get going on that. So I washed my hands, I'm going to put my gloves on. So now I need to prepare and position my client. Right now he's sitting comfortably and he can hyperextend his neck, so I'm just going to have him stay there. If he was a patient that had spinal injury, I would not want him to hyperextend his neck. So I would have him lay supine on a bed, which means laying on your back. That way you can just rest his head on the pillow instead of having to hyperextend. So I'm going to need to wash his eyes before we begin. So I'm going to wash from the inner to outer canvas. And this will just remove any crust or drainage that the eye has. I'm going to wet this. I'm just going to wash your eyes. If you could close it. Go from the inner to outer canvas. Now that that's done, I'm going to instill the eye drops. And I want to make sure that I instill them in the conjunctile sac. So I'm going to grab my tissue and my medication. I'm going to stand behind my patient, put my non-dominant hand on his forehead, and then take my cap off here. And I want to make sure that my eye drop is at least 1 to 2 centimeters away from the eye. So I'm going to pull down to expose the conjunctile sac, which is the lower eyelid. I'm going to have you look at the ceiling and administer the proper medication. If that were to have fell out of his eye, I would have had to repeat the procedure. And he gently closed his eye after administration. If it caused systemic effects, after I had administered the medication, I would have pressed on the nasolacrimal gland. So now I'm going to remove my gloves. And in summary, most people do not know how to properly administer eye drops. So I've shown you the proper steps in order to administer them properly. Next time that you give eye drops, I encourage you to prepare the patient and position them correctly, administer the eye drops, and after installation. If it were an eye drop that caused systemic effects, make sure that you do press on the nasolacrimal gland. I also encourage you to think about your eyes. They're very sensitive, so if you would administer eye drops in the middle of your eye or in the corner of your eye, you really are damaging your eye. So really make sure that you do put the eye drops in the conjunctile sac. Lastly, if you have experienced any systemic effects while on eye drops, it probably is because you were not pressing on your nasolacrimal gland. So don't let the lack of knowledge harm you from getting those kind of side effects.